Good morning, everyone, and welcome to today's webinar on COVID safety and hygiene protocols to protect our drivers. My name is Daniela Jurkic and I'll be your moderator today. And today's webinar is sponsored by our Platinum partner, BP. So, allow me to introduce you to today's speaker, David Johns, who by now you're probably familiar with. David looks after our human resources and industrial relations inquiries. On today's webinar, David will be discussing how COVID-19 is spread and how to know its symptoms. We'll be going through managing drivers' risks and exposure to COVID-19, but also looking at discussions on temperature checks and the correct use of face masks. David will also touch on considerations and preparations for long-distance journeys and what is required from you to operate under these circumstances, and also preventing the spread of COVID-19. So before I hand over the mic to David, let's just go through some housekeeping items to cover the presentation. I ask that you all put your microphone on silent to avoid any disturbances during the webinar. However, we would like to hear from you during our presentation. If you do have any questions that aren't covered by David, please feel free to type in your questions in the questions pane of the control panel. You will see that on the right-hand side of your screen. You can send through your questions at any time during the presentation and we'll get to them at the end. So without any further ado, let me kick over and welcome David. Over to you.
Thanks for that kind introduction, Daniela, and welcome everyone. Just to start with, as Daniela indicated, today's webinar is sponsored by our Platinum partner, BP. And I trust all our members are enjoying the industry-leading discount that you do get with BP. So without anything further, let's get into the subject of today because it is quite meaty and continues to develop. So look, just up front, I will, this presentation has been delivered before, but I've changed it significantly to reflect current developments and things like that. So there are a couple of the slides I will touch on because I've left them in there in case people want to use this as a resource or for use in their own workplace. So I've left slides in there. I will only touch on them because we've probably done them to death. You've heard them in the media and everything. And this is in fact one of those slides of that very thing. So, you know, COVID-19 has been with us now since at least March. It's been impacting us when we went into lockdown. The history of it, originally identified in Wuhan, China. The technical name and everything for it is there on the screen. The screen still largely reflects the situation because the virus is still in that new status. The scientists, the medical specialists and everything are still learning elements about it. You may hear on various things in the media. If you're like me, you've probably been COVID-19 to death almost. Again, so coronaviruses, it is a large group. Typically, they do not cause too much problem in humans because, you know, they are such things as the common cold. And unfortunately, this isn't the first time a coronavirus has jumped from animals into humans. We've had the SARS, the MERS, and now SARS-2. Now, hopefully, again, I'm preaching to the converted here. Hopefully everyone does know what the symptoms of COVID-19 are. So again, some people may experience only a mild illness, others it may develop into full pneumonia and you end up in ICU in a pretty serious way. Typically the symptoms: fever, cough, fatigue, sore throat, shortness of breath. There are other ones that some people sometimes experience, which are now being linked with it, such as altered smell and taste. However, as you should see on the right side of your screen, The Australian government, health department, other agencies have developed various posters and other things like that that you can put up around the workplace. The one that you see on the front there is COVID-19 identifying the symptoms. So it actually looks at what COVID-19 symptoms are in comparison to general colds and flu symptoms. So if you haven't already got those posters up around your workplace, if you're not familiar, I would encourage you to download them, get them up around your workplace, and make sure all employees understand what the symptoms are. So again, hopefully everyone does know that how the COVID-19 spread. Basically, it's the droplets that we cough or sneeze out, even sometimes some of us speak if we've got a bit too much moisture in our mouth. So it's where those droplets or whatever are inhaled or otherwise enter into the body. So it is typically by touching something or being close to someone who is infectious, and then it moving to our eyes, nose, or mouth, which is typically the entry points into the body. Now, the key risk for drivers is the fact that during all stages of this pandemic, we've had to keep the road transport task moving. And so typically people operating in the road transport space have been deemed essential travellers. And so apart from increasing administrative elements around permits and other things like that, typically anyone engaged in driving a heavy vehicle that is involved in freight transport has typically enjoyed movement across borders, even if hold-ups and other things have occurred. But the fact is the drivers are also interacting with people outside of their normal workplace, outside of their normal family, when they're making deliveries, when they're having contact with inspectorate staff, other things like that. So the indicators are that they're probably 2 to 5 more times as likely to also experience high risk factors, which place them in a higher risk category if they were to contract and develop COVID-19. And as I've got there, you know, again, they're at the mercy of other businesses, people for food, hygiene, and other basic needs. Now, key responses to COVID-19 in the workplace are, apart from having the health directions and other things like that, the Workplace Health and Safety, the Work Health and Safety Act, or the Occupational Health and Safety Act, where that still is the title of the safety legislation in whatever state or territory that you may be in. It's still the principal piece of legislation that governing, be it an employer or a PCBU, person operating or undertaking business, that you need to be mindful of. So therefore, when we're talking about controlling exposure, risks, hazards, etc., it is that element. We come back to the hierarchy of controls, which people who typically operate in the safety space would be very familiar with. So again, as the little inverted triangle indicates, in that hierarchy of controls, the best is the elimination. Where we can't eliminate a particular risk or hazard out of the workplace, then it's substituting engineering controls, administrative controls, and then personal protective equipment as our last line of defense. So basically then, continuing that element of discussion in relation to the the Work Health Safety Act. So translating the primary duty of care of employers towards employees. So as employers, we must do what we can to ensure the health and safety of our workers. So as that first element, going back to that hierarchy, we eliminate the risk of exposure to COVID-19, but again, the criterion on that, or the test on that, is where reasonably practicable. So therefore, if in that first element, making sure people who are not well do not attend work in that first instance. So if we are unable to completely eliminate the risk of exposure, then the next steps to minimise that risk again, the test is as far as reasonably practical. So protecting workers from the risk of exposure to COVID-19, some of the examples then: requiring workers to practice physical distancing in the workplace, and ideally even outside of the workplace when they're not at work, requiring workers to practice good hygiene, requiring them to stay home, good hygiene, and requiring them to stay home when they're sick. Also, it comes back on us as employers to make sure that we are cleaning the workplace regularly and thoroughly. This also falls back on workers, because if they have a particular space or anything, or if they're using shared facilities such as where they may take their lunch and things like that, they also have that responsibility to assist in keeping that area clean. Now, following on from the duty to employees, we also have duties to other people. So that comes into the parameter then of where we ensure that our business or our undertaking, using the language in the Act, does not put the health and safety of other people, such as our customers, clients, or visitors, at risk of contracting COVID-19. And the ways we can do this is by requiring them, when they come into our workplaces, requiring them to observe the practice of physical distancing, the 1.5 metres, hopefully we're all familiar with, contact deliveries and payments, also requiring them to practice good hygiene. And so making sure that, again, if they've taken a meal or used facilities in our workplace, making sure that they're leaving it in an appropriate condition for the next person coming along. It's also the other element of requiring people to stay away from the workplace unless it's absolutely essential they be there. So this may include asking customers not to come to your workplace, family, friends, visitors, and things like that, really making sure that it's only when it's absolutely necessary that they're in your workplace. And by workplace, that extends to the cab of the vehicle, and I'll touch on that a little bit further, a little bit later on. As an employer, we also have the duty to maintain workplace and facilities under the Work Health Safety Act. So that's basically making sure that whatever is in the workspace, and that includes the truck, does not put the workers at risk of contracting COVID-19. So again, this translates to making sure that there is regular and thorough cleaning, restructuring the layout, or putting clear delineation markings on the ground, the same as hopefully you have with plant and people separation in the workplace, so that you've got clear walkways, you've got clear delineation between where people may be sitting to work and where people may be taking their meal. The same sort of thing then, making sure that not everyone's crowding into a small room, which goes on to the one there at the bottom, limiting the number of people in the workplace at any given time. And this is really, again, driven by the square meterage that you would have. So for those people who typically play in the safety space, you'd be very much aware that each employee, if they're sitting at a desk or things like that, there is a required amount of space that is available to them to meet the work health safety standards. The same thing then, extrapolating that further, the number of people in a particular room or building is again governed by some of those health directions that have been issued in the various jurisdictions. So the other element of this duty in relation to workplace and facilities is providing adequate facilities to protect workers. That includes making sure the washroom facilities not only clean and everything, but there is adequate supply of soap, water, in the absence of electronic dryers and things like that, paper towel. Because again, if you could have electric dryers, hand dryers, of course they're always better, because the requirement to dispose of the paper towel and everything is removed on that. Where it's not possible for workers to wash their hands, they should be provided with hand sanitizer, and that's at least a 70% alcohol containing product. Also making sure that staff rooms and other office areas are regularly cleaned and allow for that physical distancing requirement as well. It's also, again, beholden upon us to make sure that workers are provided with regular breaks to use the facilities, and we need to acknowledge that, in fact, during the pandemic, we're all being encouraged to wash our hands as frequently as we can, and particularly before we go putting our hands anywhere near our face, our nose and mouth, etc. So a key element around preventing the spread of COVID-19, and hopefully this, we're all on board with this. So this is just bringing those elements together in one slide. So the heart and soul of it is maintaining good personal hygiene, and that's the responsibility of every one of us. We need to make sure we wash our hands frequently with soap and water. In the absence of soap and water, as I said, at least a 70% alcohol-based hand sanitizer. We also probably need to recognise that some people, if they have industrial dermatitis or something like that, there may be the need for hand cream and other things like that to reduce the impact of that hand sanitizer on their hands. We need to make sure everyone covers their coughs and sneezes, use tissue, or in the absence of that, we're using the upper sleeve. The key element is to avoid the droplets that we may sneeze out or cough out to get into the general atmosphere and environment. If you're using a tissue, immediately put it in a bin, an appropriate receptacle, and ideally wash your hands. And this might sound like the food nasty, but in this time, it's not ideal if we're sharing food, drinks, or personal items, and I include in that mobile phones. And you know, this goes not only in the workplace, but to events outside the workplace, where, you know, sometimes we might go to the local restaurant and have a banquet where all the food's on a carousel in front of us and things like that. Ideally, we avoid those situations as much as possible. And the one element which, if we're not all on board now, hopefully we get everyone on board. If you have any symptoms, if you do not feel well, no matter how mild, you need to stay home, or we need to make sure our workers stay home and that they seek appropriate medical advice. And look, no apologies for this. This might seem pretty basic, but in fact, there is a standard for how to wash your hands. Because at the end of the day, this is one of the basic practices we can all adopt, which will help us reduce that risk of transmission of COVID-19. The key element is that it's washing thoroughly, and that's both sides of the hands, between the fingers and the wrist area, for at least 20 seconds. And I've got a nice little graphic there, wetting your hands, getting the soap, lathering it, and it shows you how to do it. Scrub then for approximately 20 seconds, rinse under clean running water, and then drying of your hands, or as it says, air dry them if you haven't got a hand blower. Now, one of the things is there's been a lot about and high demand on hand sanitizer. Now, regardless of the alcohol content, other things like that, alcohol-based products, which are typically in the 60 to 80%, do kill the virus very well. But at the end of the day, soap, the very content, the basis of soap, still works as the best substance to combat any virus. And it is because of the interaction of the soap molecules with the virus membrane. So as it says there, soap loosens the glue between the virus and the skin, but it also holds proteins that the viruses do not like, thereby helping to combat the transmissible element of the virus. The other advantage is the fact that when you're using hand sanitizer, you're not going to use half a bottle each time. You're going to use a squirt as they recommend. When you're using soap and water, you've actually, because you've got the tap running and everything, you're actually cleaning your hands in a far better and more complete way. Whereas if you're using sanitizer, you're typically rubbing it on the hand, maybe on the back and between the fingers a bit, but you're not actually cleaning the whole of your hands as well as you do, hopefully, when you're using soap and water. But again, it's using the best product we have that's available to us at the time. Now, sanitising the vehicle is an extension of that. Given that for drivers, the vehicle is basically their workplace, cleaning of the vehicle is important. And it's important that any cleaning products being used, ideally you check against the vehicle operator's manual or your vehicle manufacturer to make sure that, particularly in new vehicles, you're not voiding the warranty. As I've got there on the slide, mild soap and water, ultimately it's the best and generally preferred choice. Not preferred is diluted bleach or alcohol-containing products. While they can be used on most surfaces, long-term use can often damage the surface of, be it the plastic, the leather, the vinyl, whatever in the vehicle. I won't go into this in high detail. If you happen to want to download the slides, or we actually have a sheet which provides good guidance on cleaning each part of the vehicle, then simply give us a call, drop us an email, and we can send that to you as well. So again, as you will see through these slides, typically it is mild soap and water, which is the ideal cleaning agent. In the absence then, 70% isopropyl alcohol, but as I said, be aware, long-term use on various surfaces are detrimental to the good maintenance of that surface. One surface I will touch on a little bit more is more modern vehicles where you have information screens, the same as your mobile device, iPad, etc. Touch type screens have a film and anti-glare treatment which does not respond well to chemicals. So ideally, when you're cleaning those surfaces, it is mild soap and water with a soft cotton or linen rag. Don't scrub the screens because you can actually wear them over time. If you're going to use a liquid crystal display LCD display cleaner, make sure that it does not contain alcohol, ammonia, because they can damage the screens. Again, it's an absolute no-no. Bleach, diluted bleach, alcohol or ammonia, because you will damage the screen. So in relation to managing the risk of our drivers' exposure to COVID-19, ideally there's a number of things we can do. So key element to it, as part of that social distancing requirement, is limiting the contact between drivers, suppliers, customers and others. And in fact, the developments in this space now, typically as part and parcel of the permits for cross-border operations, the driver is to remain in the cab wherever possible, except for times when they're getting out to get fuel, food, other interactions perhaps with inspectors, etc. In relation to your customers and deliveries, we do note that many of our members have contracts which do have the requirement of a signature on a delivery docket as proof of delivery. It's important that you have conversations with them in relation to accepting electronic signatures, photographs showing the delivery, and other methodologies there. Wherever possible, again, encouraging drivers to use electronic methods of communication. Other key elements, and in fact, for most of the cross-border operations now, when crossing the border, it is only driver operation only. There should be no passengers in the vehicle unless it's in a genuine two-up operation. If you do have a passenger, there needs to be a separate permit for the passenger, but particularly again with what's happening with the border restrictions between Victoria and New South Wales, Victoria, South Australia, it is best to mandate that driver only, no passengers permitted. And as I've got on the screen there, coming back to making sure people can clean their hands, sufficient hand sanitizer and disinfectant wipes. It's now getting into the point, particularly if you've got drivers going into hotspots, which is large, the Greater Melbourne area and a couple of regions in Victoria, and the hotspots in New South Wales. While they're not mandated at the moment, it is in Victoria. The use of face masks. So you would need to ensure that your drivers have a suitable supply of appropriate face masks. And given this more recent development, I do have some slides which I will cover that off a bit later on. The other element, and while a lot of the restrictions on food outlets, fast food outlets, place hotels and things like that, the trip planning is still very much important because cleaning of facilities and things like that is not everyone is cleaning facilities to the same level. Public toilets and things like that, you may still experience closures. So access to fuel, food and facilities. Also, while I think most delivery centres and things like that have withdrawn their restrictions on drivers using local facilities and things like that, that's not guaranteed. So you do need to be aware for the driver's ability to use facilities, etc. Again, the cabs in some prime movers are better able to, for a driver to take some food with them than others, but making sure that at least the essentials, if they can do hand washing, otherwise hand sanitizer, any personal protective equipment needed, and cleaning products to maintain the cleanliness of their workplace, which is the cab. In relation to border controls, most states and territories have controls for people crossing the border. It's not just paperwork, but it's a permit that's required. And basically the only state off the top of my head that doesn't have restrictions is Victoria, because they're so focused on containing everything. New South Wales and South Australia, Queensland have all placed restrictions on people entering out of Victoria. So again, check requirements and gain any necessary permits beforehand. And we do publish a list updated regularly on what those border requirements are. Now, one of the developments that come in, and this is first showed its head in New South Wales, a COVID-19 safety plan. So as New South Wales changed its border restrictions and entry requirements between itself and Victoria, rather than being a ideal to do thing. A COVID safe plan is now one of those items that has to be in place to ensure that your driver, the operators are not bound by the requirements to self-isolate upon return into New South Wales. So by having a COVID safe plan in place, and there are guidance, we also have a policy, workplace policy you can download. It will need to be updated on developments from yesterday, but we can assist you in that space. So having that COVID safe plan in place is now a requirement to remove that self-isolation requirement on a driver coming back into New South Wales. Also, South Australia and New South Wales, you need to, as an essential traveller, there is now a requirement to keep and retain records for 28 days of stops and close contacts. So the details that do require to be kept: name, phone number, and other contact details of the contact, and the location at which that contact occurred. If those details are not known and it's not reasonably practical that you could obtain it or your driver could obtain it, then the record of the time and the location at which the close contact occurred. So, and just for completeness, a lot of questions have come up about what is a close contact. A close contact is universally defined as where there has been face-to-face contact for greater than 15 minutes, as I say, cumulative over a course of a week, and sharing of close space for a prolonged period of more than 2 hours. So in those situations, if you've been in a close contact situation for 15 minutes or in a confined or closed space for more than 2 hours, then potentially those other people in that space are close contacts. Now, as I indicated earlier in this webinar, Victoria has now mandated the wearing of a face mask. However, just to really set the scene, the Australian Government Department of Health still, even given the developments in Victoria, does not generally recommend the wearing of a face mask by healthy people in the general community. However, that always comes with that caveat. There may be occasions where face masks are recommended, particularly in situations of high community transmission and where physical distancing is difficult to maintain, which is the exact scenario that we have playing out in Melbourne. Transmission is occurring at a far higher rate than we've seen in Australia before this. Some of the ability to trace where it's come from has been limited, and we've seen significant numbers. Hence, what is occurring in Victoria matches this very situation, because Victoria has high community transmission, and often, particularly in situations such as using public transport, being on an aircraft, physical distancing is difficult to maintain. Now, let's just be aware what this mask does. The main benefit of wearing a face mask is that it protects other people if we are unwell, because the wearing of the mask will reduce the chance of us passing the virus on to others. It's not so much that it protects you, me, as the wearer of the mask, but if we are in the situation where we have the symptoms but we haven't recognized it, then it reduces that risk of us transmitting it to someone else. And as I've got there, the Victorian government has implemented the mandatory requirements for wearing a face mask. Now, for drivers, that's not necessary in the cab unless they're in a two-up situation and you've got someone in the cab with you. But as the driver is getting out of the cab, then in fact, they need to have the face masks available so that they can put them on. Now, just to make sure, and this is one thing that I think, drawing upon a bit of a background in health that I do have, it's one thing to say that we've got to wear them, but if we're not putting the masks on, or if our drivers are not putting them on properly, then in fact they can actually cause just as many problems as we're trying to head off. So the key elements, the key do's, and in this situation I'm referring to surgical masks, which are the disposable ones, typically blue on one side with a white element on the other side. They're multi-layered and they're specifically manufactured to a certain requirement because these are the ones that are used in health settings. So before you actually go to use the mask, make sure that you've washed your hands before touching it. As it says, check the mask. Make sure you identify the top side. On a surgical mask, there will be a little metal piece or a stiff edge. Ensure the coloured side faces outwards. Place the metal piece or stiff edge over the nose and cover the mouth, nose and chin completely. Adjust the mask, making sure you don't leave gaps on the side. Otherwise, if there's gaps on the side, it's not fitting properly, you may as well not be wearing it almost. Key thing to remember is to avoid touching the mask. When you remove it, remove the mask from behind the ears, keep the mask away from you and surfaces, and then discard it immediately after use, preferably in a closed bin, and wash your hands again. Now, there's some big no-nos when we are using masks. So, as the little slide says, these are the don'ts. It's no good using a ripped or damaged mask. Same sort of thing, it's not going to do the job that it's meant to do. Do not wear the mask only over your mouth or nose. It's got to cover the entire nose, mouth area. As I said previously, do not wear a loose mask because, again, it's not going to be effective. One thing that I'm pretty sure you've seen around, people constantly touching the front of the mask, adjusting it, pulling it down to talk, they're absolute no-nos because you're actually contaminating the mask. Thinking about it, you haven't washed your hands and you're playing around with the mask. The other element is that, you know, when you're breathing normally, you're going to produce moisture into the mask, and all of a sudden, by compressing it, you've increased the chance of that moisture moving from the inside retaining layers to the outside, which even creates a further issue. Do not leave the mask in reach of others, and do not reuse the mask. If you do need to, if you're taking it off for a short period, such as a driver, have a clean area, ideally the wrapper or something like that, where you can face it, the blue side down, making sure that you keep it as clean as possible. But again, typically the surgical mask is a one-use mask meant to be disposed of once you've taken it off your face. In relation to cloth masks, ideally, again, it's a multi-layer mask that you're actually using, and it should be washed at least once a day after use, or as soon as it becomes wet or dirty. It can be washed by itself or with other washing using soap or detergent and hot water. And again, this is just basic stuff. Drying the face mask thoroughly before reusing. And please do not pay attention to some of these bright sparks on the internet who carry on about microwaving your mask, the same as heat bags. If you overheat, have it on the wrong settings, it's easy for the material to ignite and you then have a little bit of a fire on your hands. Now, one of the things that we have been asked about in is topical is temperature checks, conducting of temperature checks at the start of work, other things like that. So safe work, and again, I go to the best source of information, hopefully what is the one true source or a true source of information. Safe Work Australia and most of the state safety agencies, WorkSafe, whatever you want to call them, advise against taking temperature for several reasons, but it is primarily because it has limitations as a control. The other thing that you need to be very much aware of is when you're taking a worker's temperature, the collection of that falls under sensitive information, which is then a subset of personal information under the Privacy Act of 1988. And anyone who's aware of it, there's a number of privacy principles under the Privacy Act, and it's Principle 3, APP 3, which provides that organisations must not collect sensitive information unless the individual consents, and then either the information is reasonably necessary to be collected for one or more of the employee's functions or activities, or if the employer reasonably believes that the collection or use is necessary for the health and safety or public safety. However, if you are considering temperature checks, there's a range of things I would suggest you do before actually implementing it. One of those would be to seek the advice of the health authority in your jurisdiction on the appropriate method of temperature checking, the equipment to be used, the PPE and control measures required to ensure safe testing. Because this, as it does come down later, is making sure that the person who's conducting the test is trained, but also appropriate PPE and everything for them in carrying out the test. Given that one of the key elements we depend upon is the Work Health Safety Act, there's a duty to consult with workers and their health and safety representatives and take their views into account. Again, as hopefully everyone's aware, there is a range of protocols or standards which are required to be met before introducing a new safety element in your workplace, which covers off the consultation, training, etc., before fully implementing and holding people to account. So that element falls into that next dot point, providing instruction to workers on the process, but also emphasising the importance of other control measures in the workplace, providing information, training, instruction, supervision, as well as the PPE for the workers who are going to conduct the tests. Also making sure that you have appropriate leave, stand-down arrangements for employees if they do register a high temperature. So again, this should all be covered off in a policy before you head that direction. Now, again, this is a slide I added in this morning. Hopefully, as most people are aware, there has been some communications out about a protocol for domestic border controls freight movements, which was agreed by the National Cabinet last week. The protocols, again, if you want a copy of that, we can, if you give us a call, we can send that to you. However, while a number of those elements about standardising the cross-border permits to 14 days, some of the other items which we'd been advocating all governments adopt, one of the other elements that is in that protocol was the voluntary testing of drivers for COVID-19. So yesterday, late yesterday afternoon, we got communications from Transport for New South Wales advising us that New South Wales has introduced new requirements for freight operators crossing from Victoria into New South Wales. While it's not immediately mandatory, they're looking for people to increasingly move to complying with this. The latest update of the COVID-19 safety plan requires workers who have been in Victoria in the past 14 days to be tested for COVID-19 every 7 days. even where they're not showing symptoms. Now, the responsibility for these tests sit with the operator, and the risk is those who, when this becomes fully mandatory, those operators who don't meet the requirements of the permit may find that the operator or the driver is not being permitted back into New South Wales. Now, we are seeking further information because the information that came out of Transport for New South Wales is ambiguous about what a driver is supposed to do after having been tested in relation to the requirement to self-isolate, or whether they continue to go about their driving duties. What happens if they are away from home and they test positive in one of these tests? But also a number of members have been contacting us this morning because, in fact, the time drivers are away from home can be quite significant in a week, and where are they supposed to test? So again, it's not like you can roll into some of these testing stations in a semi or a B double, and there's also then restrictions on the use of fatigue regulated heavy vehicle for personal reasons. We also recognise that often there's a fair wait in queues and other things like that to get testing. So there's a lot of questions which we've approached government and various representatives to seek clarification. Then to cap this off, this morning we had information that South Australia is either adopting or has adopted the same requirements. So we will be putting out further communications. It is something that everyone needs to be aware of. So look, that's basically what I've got for today. What I would like to do just before closing off and getting into questions is just highlighting our next webinar. The webinar is entitled To Employ or to Contract? That is the question. So basically, we'll be looking at clear distinctions between what is an employee, what is an independent contractor, how to choose the right type of worker, be it an employee or an independent contractor, for the role that you have within your business, as well as covering off why it's so important you get it right. So look, you've probably all agree that you've heard enough of me talking. So I will hand it over now back to Daniela if we have some questions. Thanks, Daniela.
Hi, thanks for that, David. Really well done. We actually don't have any questions at the moment, but I might, I'm going to leave the floor open to our attendees to pop in their questions in that right-hand side pane. And I just do want to run through that this webinar will be distributed via email by tomorrow, and we'll pop in the slides so people have access to that. On our website too, on the coronavirus page, we do have a list of places where people can get tested for coronavirus. That is listed on there. And the link to join for the webinar that you mentioned for August the 19th will be included in our newsletter coming out this afternoon. Now, we do have another question that has come through, so just let me open up my screen and read this, and then I'll share it with you all. So it says, so David, WA has brought changes in, and if a driver is in a state for more than 48 hours, they must get a COVID test. They then have to wait there for their result. So, okay, so if a driver has been in WA for more than 48 hours, they are required to get a test. Do they have to wait in WA before they can leave?
Yeah, this is one of those other areas. So the requirement is if the driver's going to be anything more than transiting in and out, which is basically that 48 hours, then yes, they must get tested. The challenge then is getting a location as well. So what we've suggested is that it actually should be at, the facility should be made at the border crossing. So look, where they do test, then typically under WA requirements of the direction at the moment, once you've tested, you then should be self-isolating, whether it be in your cab, in a motel, or other things like that. I actually had this very situation with a member, I think it was yesterday, because by the time they get up to the far northwest, up to the mines where they were going to be doing deliveries, it was well and truly past that 48 hours. So again, this is one of the things we're seeking to clarify with the WA to make sure that we can get the best advice to members. So please keep an eye on the communications coming out of NatRoad, because as we get confirmation out of the various states and territories where they change things, we'll be updating members as soon as we can.
I've actually got a bunch of other questions, David, so we're going to be on for a little bit longer.
No, that's all right.
And just to everyone listening as well, with the questions that we do answer, I'll also endeavour to pop the answers up on our site, and we'll pop that in the webinar communication so you can get a link to it, because there are a fair few, and I think some of them we might need to take offline. But the next one is, David, how many days does it take to get results? In regional areas, we've been told it can take up to 5 days. Do you receive something to say you are negative to show that you are able to travel?
Okay, the time frames that we are aware of, and I clarify it is what we're aware of, because again, largely none of us in NatRoad are travelling at the moment. So we depend upon information coming from members. So again, I do qualify it from what we understand, and as being presented in the media, the turnaround on testing is variable. And to our understanding, yes, there is a confirmation of test result once those results have come back to you, and I understand it's generally supplied by electronic format. So that is one of the things that as people are going to be increasingly governed in this cross-border space, it will be expected that you have a copy of a COVID safe plan, copy of the testing, copy of other documentation which supports the fact that you're ticking all the right boxes, including the close contact forms. They're all going to be things that unfortunately are going to be part of the scenery for some time by the looks.
Now I've got another tricky one. For a driver that lives on the Albury-Wodonga border, the only place that they can get tested is in Wodonga, Victoria. The problem is with this test site, it's not suited for trucks, and on top of that, they also need to make an appointment. Under the current regulations, they're required to get a test every 7 days. But if they're going to go to this clinic, they're going to have to go on a Saturday and make an appointment. So what happens if they can't get an appointment for that Saturday, which means they breach the rule of getting tested every 7 days?
Well, that's, again, we're in a period where the New South Wales government has said this is occurring, seeking operators to become compliant as quickly as possible. And this is the unfortunate element, basically the government is saying, well, if you can't comply or don't comply, then you run the risk of not being permitted back into New South Wales. Again, while we've been on this webinar, my colleague Richard has been on to ministerial advisors, other levels within government, seeking clarification, as well as trying to see what we can do about getting some reality checks on some of these requirements, so that it can be better managed for the industry than what it appears at first glance. So this is definitely a moving space at the moment for us, but it is, again, they've thrown it onto the operator, so the operator needs to make arrangements. So it may well be that you would need to make some appointments in advance, preempting the difficulty of getting people in that situation, as the question just highlighted. And as we get more information, we will endeavour to get it out there to members, because a lot of these things in those cross-border situations, it's just going to be an absolute nightmare. And we do recognise that the ability to get into clinics, drive up the truck, no matter what side of the vehicle, is just not practical.
That question actually has another part. So what if the person lives on the New South Wales side and they need to travel into Wodonga, Victoria by car to get that test? What permit would they need to return back into New South Wales?
Oh. Yeah, look, perhaps if this could just be checked with us outside of this webinar, because in fact the proposal was to move and change the requirements in that Murray area. So what applies in Albury Wodonga at the moment, I would prefer to take the question on notice and come back outside of the webinar, rather than giving wrong information which leads people up the path. And look, this is the point. What we're trying to do in these webinars is to pass on information, but please contact us in relation to your specific circumstances, because it is, again, making sure the advice is specific to you and your circumstances, but also the fact it's still such a fluid element at the current time.
Joe, who actually asked that question about Albury and Wodonga, said that wouldn't make sense to have a pop-up testing site at the border crossing for interstate transport drivers to be tested.
Well, that's, yeah, it all comes down to the more they impose these things, the more we need that huge reality check as the practical elements. And it was the same in the conversation with a member in relation to the South Australian, Western Australian border. You know, it's quite a distance once you've crossed the border into WA, limited government centres, and then you've got to go into things like Hotspot, the medical app, to find out where respiratory clinics, because a lot of GPs have set up respiratory clinics. But again, it comes down to that element of the practicality of either getting in a heavy vehicle, or the very fact that the use of a heavy vehicle still personal use of a heavy vehicle under the fatigue requirements. A fatigue-related heavy vehicle for personal use, you've still got to put into your work diary and things like that, and there's a very finite limitation on the time that can be used. So to be spending a couple of hours lined up or sitting in a clinic waiting for these things, it's just, the impact on the industry is significant, and it appears on first glance that unfortunately these are some of the things that haven't been taken into account. So one of the things we are advocating on is getting, if you're going to do these things, there's got to be clear guidelines, and there's got to be testing facilities set up at appropriate locations. Again, we will keep members advised as we get further information in this space.
Now, we've actually had a member state, our driver was told this morning that he had to wait at the test clinic until a negative result was received. Any comments on that one, David?
I'm not aware that they can turn the result around that quickly. This is one of the things, because at the moment we are aware there's two types of testing: the nose or throat swab, which carries a bit of discomfort with it. It's typically the nasal one, to my understanding, but there's also a saliva one. The nasal swab supposedly is the more reliable, but we have no information that the turnaround time is that quick. Again, that's one we would need to take on notice and come back on.
Okay, and then another question in regarding close contacts. The question is, do we need to keep a record of every stop, which is currently what they do, or do they only need to keep a record if they are in close contact with a person?
Right. One of the, again, please excuse me, I'm backtracking off the top of my head. It's the requirement in New South Wales to meet the COVID safe plan element, that it stops and close contacts. From memory, South Australia, it's just the close contacts. But again, given the national protocol now working on the basis of the highest requirement, it is stops and close contacts. So what we would recommend is that the driver is maintaining a clear record of where they have stopped, but then the secondary element is where they have been in the location that puts them into that close contact definition with a particular individual for 15 minutes, or in that enclosed environment, from memory, it was that 2-hour mark or something like that, then that you're collecting the details wherever possible, or the clear times that you were in that location. And again, adopting it as a universal requirement, not driven by which state you're in, because at the end of the day, I think we're going to be in a situation where it's going to be part and parcel of operating cross borders, full stop.
We've got a few more, David. Very popular topic. And again, everyone, we will type these questions up.
In actual fact, by the hit on the phones and the emails this morning, it's little wonder. Every time something changes in this space, it is definitely going to be more questions than nothing. So
yes. So next one,
I've got time up my sleeve. Hopefully it's still got topical for members to stay on.
We have another 5 minutes, and I will reassure everyone that these questions will be put to the member team, and we'll answer them and have that distributed with the email that comes along with this webinar. So the next question, if a driver gets tested, is meant to get tested every 7 days, but also has 3 days off, how does that work? And that's specifically for New South Wales.
Yeah, this is what we're seeking clarity on, because unfortunately, as with some of these elements, regardless as to whether the policymakers have knowledge of the industry or not, it would appear the policy is developed without understanding the full impacts or the practicalities for the industry. Now, you know, they're doing their best, I appreciate that, but this is one of the, again, as I said during the earlier discussion, it is one of the areas of ambiguity which we're seeking clarification on, and we'll be communicating as soon as we have that clarification to members.
Great. And this next question is actually really interesting. So what if someone gets tested for COVID and it comes back positive? Do they have to isolate for 14 days and then get tested again before coming back to work to make sure they don't have it?
Yes, basically, as soon as there's a positive test, all the requirements around, and I cringe every time I get into this isolation element, because typically quarantine is where you don't have it, but you need to take precautions to make sure you don't have contact. Isolation is once it's confirmed that you have something and you need to do it. So yes, look, once you have a positive test, all the requirements are around that positive test, isolation, testing before returning to work and other things like that, having a clear test, all those elements kick in. Now, with the testing on the road, it throws in challenges for people running businesses, for owner drivers, the whole lot, because if you get a positive test and you're away from home, the whole element then is isolating within your truck. However, if the virus escalates, or the disease as such, once it gets into the body escalates, then you're going to be seeking medical treatment and support out away from home. So it's going to throw all sorts of challenges up, because you're not just going to have a driver that's feeling off, you're going to have a driver who may not be aware, testing positive, and then you've got to have a protocol to jump into place, getting them back across the border, home, getting them into medical treatment, etc. So yeah, it opens up all sorts of issues, the voluntary testing. But again, this is one element where if you're not feeling well, if a worker is not feeling well, the first element is don't turn up to work. don't commence the trip in the first instance. But again, this is going to be a developing space, so we will get information out as we can.
Excellent. So, David, that actually concludes all our questions. What we will be doing is we'll collate all those questions. We'll have some answers written out for that, because some will need to be taken offline. Though the answers to those questions will be distributed along with the webinar via email to all members, so you'll have access to that. However, if you have any further inquiries, do send it to info@natroad.com.au. We're more than happy to answer them for you. And as David mentioned, this is a moving feast. So as soon as we get more information, we'll get them out in a timely manner. So thank you. And David, did you want to say a quick thank you?
Yeah, look, thank you everyone for attending, joining us today. Appreciate that we advertised this one at short notice, but we'll look at running another one on this very same topic, perhaps in another couple of weeks, again, to give people who haven't had the chance to join us, but also with an update of developments and things like that. So watch our adverts, and we appreciate your time today. And I can't reinforce enough, as Daniela said, don't hesitate to contact us with your questions and things like that, but also bear with us as we do seek confirmation from government, from agencies, because we do note that their communications aren't necessarily giving everyone the clarity that is necessary to be operating in this industry. So thank you very much, and just acknowledge our partners as on that slide as well.
Beautiful. Thank you, and goodbye, everyone. We'll chat soon. Bye-bye.